Mr. Speaker, I move you, sir, that House Bill 135 be taken from its place in the orders of the day, read for a third time by title and sponsor only, and placed upon its passage.
Motion is made and seconded that House Bill 135 be taken from its place in the orders of the day, read for the third time by title and sponsor only, and placed upon its passage. Clerk, please report.
House Bill 135, an act relating to physician assistants. Representative Sheldon.
Gentleman from McCracken.
Mr. Speaker, I yield to the gentleman from Warren 17 for explanation of the bill and motion thereon.
Chair recognizes the gentleman from Warren 17 for explanation of the bill and a motion thereon.
Mr. Speaker, thank you very much. I'd first like to have the clerk report House Committee Sub 1 to House Bill 135, please.
Mr. Clerk, please report.
House Committee Substitute 1 to House Bill 135.
Gentleman from Warren.
This particular sub just corrected a couple of duplicate issues that the LRC found, and makes no change in the bill at all, so I would move adoption, please.
Motion is for the adoption of House Committee Substitute 1. Is there any discussion? Seeing none, those in favor signify by voting aye. Aye. Those opposed, nay. House Committee Substitute 1 is adopted. Gentleman from Warren.
Yes, Speaker. I'm glad to rise, and I'm honored to speak on behalf of the physician assistants today. There's 1,800 physician assistants in Kentucky, over 200 health professional shortage areas in Kentucky, and this bill will go a long way to take care of that. I'm also proud of the way this bill came to pass. It's been up several times in the past, but never in this manner, and let me explain. We had the Kentucky Board of Medical Licensure, the CAPA, which is the Physician Assistant Association, the KPHA, which is the Pharmacist Association, as well as KMA involved with any concerns they had over this bill. This bill is allowing prescriptive authority for controlled drugs for physician assistants. And those guys got together over the interim. They have put together a bill, and I get to deliver it, so I'm honored to do that. Let me give you a brief summary on the bill, and be glad to take some questions. But this bill would permit a physician assistant to apply to Kentucky Board of Medical Licensure for authorization to prescribe Schedule II through 5 controlled substances. Prior to being eligible to apply for authorization, a physician assistant would have to have at least 1 year of experience as a licensed physician assistant. The physician assistant supervising physician would have to approve any application for authorization to prescribe controlled substances. The supervision physician could limit the controlled substances that the physician assistant could seek authorization to prescribe. This means that a supervising physician may permit a physician assistant to apply for authorization to prescribe only certain drugs or only certain schedules of controlled substances. For example, a supervising physician may limit a physician's assistant application to only Schedule 4 and 5 if he chooses to do so. What the physician assistant applies for is controlled by their supervising physician through a supervisory application or agreement. Prescriptions for controlled substances would be prescribed much like other healthcare providers, 3-day supply on narcotics, 30-day supply on 2s and 3s. 4s and 5s would have 6-month supply, and then we have a special for those that are really caring about the weeds in this. The benzodiazepines and the crisaprotol, which is soma, muscle relaxant, would be limited 30-day supply. So all of this has come, like I said, from many healthcare professionals, and we're there. So physician assistant who is authorized by that, we added this as well because of KMA asked this one. A physician assistant who is authorized by the Kentucky Board of Medical Licensure would be required to complete at least 10 hours of continuing education in one or more of the following areas. And it's about substance diversion, pain management, addiction disorders. Use of Casper every 2 years is also part of the education they get. 5 of those hours would count towards the 100 hours of physician assistant that they're required to get already yearly. So, and I'm down to it basically, we also talk about the discipline that they may incur if they do something wrong, and we matched it up with exactly what physicians are going to go through. So with that explanation, and that's fairly detailed, but I'll be glad to take any questions.
Gentlemen, you need to,
Oh, yes. I think I'm good.
you need to
Well, I
move
just
you
need to move. If there's no
adoption.
questions, I guess I'll move for adoption. I didn't expect that.
Motion is made for the passage of House Bill 135 as amended by House Committee Substitute 1. Is there any discussion? Chair recognizes the gentleman from McGoffin for discussion of the matter.
Thank you, Mr. Speaker. To speak on the bill, please.
Yes, sir.
This is probably the single most bill that I have gotten people contacting me asking me to support this piece of legislation. And I plan to fully support it. But for anyone that may have reservations, I assure you there was no one that had any more than I did. I actually sent the first doctor on a major opioid investigation back in 2001 in Kentucky to prison over prescribing. And the first thought to me was, we don't need more people prescribing opioids. We've already got a problem. But I also realized we can't punish the good people that are doing good work because of someone we fear could be a bad actor. There are things in place to take care of those bad actors. Our physician's assistants in Kentucky, they do a great job, but in eastern Kentucky, they're vitally important to us because oftentimes when we go in, that's who we're seeing rather than a doctor. And they need to have every tool in their toolbox they can to be able to administer good health care to the people that they see each and every day. And so I rise to support it for those of you that may have concern to try to lessen that concern and saying, look, there's going to be bad actors no matter what. But we have things in place to capture those bad actors, and I think we should support this bill. I think we should support our physician's assistant. They do a great job. This is long overdue, and it's well-deserved. Thank you, Mr. Speaker.
Chair recognizes the gentleman from Boyle for discussion of the matter.
Thank you, Mr. Speaker. May I speak on the bill?
Yes, sir.
Mr. Speaker and my fellow members of this honorable body, I rise today to express my full support for this House Bill 135, modified prescriptive authority for physician assistants. Kentucky is the only state in the nation which presently has a complete prohibition on physician assistants prescribing controlled medications after Florida acted to modify their law in 2016. PAs play a critical part in the healthcare delivery model for the citizens of Kentucky and while working in a collaborative setting with a physician. They're well-trained, they're well-educated, and there is not a compelling rationale, in my judgment, in prohibiting PAs from a full scope of practice because they are providing invaluable healthcare services to our citizens every day. I've received numerous letters of support over the years from physicians who are very supportive of this bill. And recently I received a letter from a PA that outlined the reasons to support this bill. I thought he was very succinct in his argument, and so I will adapt his words into mine today. Generally, this bill will allow for more efficient and accessible health care for my patients and the ability for my supervising physician to better delegate duties to me, as well as allow a physician PA team to be able to customize the PA's prescriptive authority for Schedule 2 through 5 to their individual experience and practice needs, allowing the physician PA team to determine which medications best serve their patients. The needs will be different in a hospital setting versus an outpatient clinic and will also vary by specialty. This modified authority will provide more accurate and responsible tracking of prescriptions. Currently, a physician can supervise up to 4 PAs, but all scheduled prescriptions are tracked under the supervising physician's DEA number, creating an inflated number of scheduled prescriptions for that physician. It includes important updates to PA disciplinary and continuing education requirements, as well as statutory limits on the prescribing of certain substances, mirroring what is already in statute for other providers. Schedule 2 narcotic substances would be limited to 3 days with no refill, and Schedule 2 and 3 non-narcotic substances, as defined in KRS, are limited to a 30-day supply with no refill. As he points out, with his 12 years of experience, I frequently care for patients with painful conditions, patients with fractures, kidney stones, etc., that require a short course of pain medication until they can follow up with a specialist. Being able to write a 3-day course of pain medicine would help the patients be seen quicker and allow my supervising physician more time to focus on more complicated patients. Clearly, this modified prescriptive authority legislation will improve Kentuckians' access to quality health care, especially in rural areas. And I want to thank the gentleman from Warren for his leadership on this bill. It's been exemplary, and he's the reason that this bill is where it is. And also thank the lady from Kenton, the chairman of our Health and Family Services Committee, for her support as well. So I ask my colleagues to support this bill, and I yield the floor.
Chair recognizes the lady from Fayette 79 for discussion of the matter.
Thank you, Mr. Speaker. This is kind of a blast from the past. I actually was involved in licensure of physician assistants, whom I respect a great deal. They provide such a vital service in our physician offices, especially in our medically underserved areas. But I sat on the Licensing and Occupations Committee when this bill was presented as well. But this bill went before Health and Welfare instead of Licensing and Occupations. So my question is, have we heard from the KMA on their recommendations? I see that KMA is in the bill, but did they testify? And if they did, what did they say about their recommendations?
Gentleman from Warren.
Ma'am, they did not come and testify. However, they were involved from the get-go, starting as early as last summer, in the any concerns they had, and we addressed those concerns all the way up until the bill was drafted, at the end, and they fully supported it the way it's written right now.
Lady from Fayette.
So you're saying that the KMA
Would you like
was
to ask
supported?
another question, ma'am?
Oh, may I ask another question? Thank you.
He will yield to another question.
So am I to understand the KMA did support the legislation?
Gentleman from Warren.
I would say, I can't speak for the KMA today because they weren't, but I can tell you that they were actively involved in any concerns they had. And the way I understand it, KMA has their policy come out in the middle of the summer. So that policy changes in the summer. And so, but we had their full support in writing this, and we dealt with it, and they were 100% not opposed to this bill at all.
Thank you very
Lady
much.
from Fayette. Chair recognizes the gentleman from Greenup 98 for discussion of the matter.
Thank you, Mr. Speaker. Will the gentleman from Warren 7 yield to a question?
He will yield.
Gentlemen, what happens if the doctor loses his DEA number with a PA working underneath him?
Gentleman from Warren.
That PA would, the PA is tethered to a doctor permanently. If that doctor loses his DEA license number, that PA would not have the authority and would need to look for a new arrangement.
Gentleman from Greenup.
Mr. Speaker, can I ask the gentleman yield to another question?
He will yield to another question.
Mr. Gentleman from Warren, has the education for a PA been increased over the last decade?
Gentleman from Warren.
Yes, it actually has. I want to think it was about 10 years ago when they moved from a 4-year degree to a master's degree where they have to get their doctorate now. Yes, sir.
Gentleman from Greenup.
Mr. Speaker, I'd like to speak on the bill, please.
Yes, sir.
I was like the gentleman from McGoffin County when he spoke about the fear of more Schedule IIs getting on the market. Most people knew I fought that battle for over 40 years, still fighting it today. But with the increase in education and the reevaluation of this bill, I want to comment gentleman from Warren for bringing it forward. In the state of Kentucky, we need PAs to fulfill our paradigm that we have on the medical side. We have that model, and they provide to it really good, and especially in the rural areas. You know, our model deals with nurse practitioners and PAs and so forth, but we need this bill. We need to take care of the people that are less fortunate than us. And the only thing I ask is if we pass this bill and the Senate passes the bill, that we educate our medical associations and pharmacy associations what the difference is on each person that can write prescriptions in this state. Because it gets very confusing. So that's all I would ask, and thank you, Mr. Speaker.
Chair recognizes the lady from Jefferson 32 for discussion of the matter.
Yes, may I speak on the bill, please?
Yes, ma'am.
Okay, so I would like to speak in favor of the bill. Today I met with a group of physician assistant students, and they all go to Sullivan, and each of the students happened to be from other places in the nation. None of them were in Kentucky. But what they said is if they cannot practice to the full extent that their degree would allow them to, they will leave our state. And we discuss at length in this body about training our children and having high-quality employees who can go into the business sector. And I support this bill because I think we want to keep as many of these well-trained professionals in our state as we can. Thank you.
Chair recognizes the lady from Kenton 64 for discussion of the matter.
Thank you, Mr. Speaker. I'd like to speak on the bill.
Yes, ma'am.
Most of you know that for years I have been pretty adamantly opposed to increasing the scope of practice for non-physicians, especially in terms of prescribing controlled substances. I have a background in drug policy. I have worked on the addiction issue endlessly, and so for that reason I have been opposed to this bill until this year. I have seen the work that the Physician Assistants Association has done to really tighten up this language and ensure the safety of their prescribing and the prescriptive authority. They have worked tirelessly with the Kentucky Medical Association and others. They have come to agreements that were not achieved in past years, and so for a few reasons I have more comfort in this bill, and I rise in support. I am given comfort in the fact that they have added additional training and continuing education for prescribing every level, every classification of drug. This bill maintains a strong collaborative agreement with a physician. By virtue of the name of their profession, physician assistant, they will always maintain that strong collaborative agreement with a physician to provide patient-centered care. The other thing that really gives me comfort about this bill is that a physician can explicitly authorize or not the prescribing rights of a physician assistant. So after a year of experience, the PA and the physician work very closely together, and the physician can then determine whether or not the PA has the skills to decide whether or not they can make a determination in prescribing with medical necessity. And last, I would say the biggest piece of this that gives me comfort is that physician assistants are regulated under the Kentucky Board of Medical Licensure, and that their prescribing guidelines are consistent, and we have some standards, and I actually think that all prescribers should be regulated in the same manner, but that's for another day. But I do rise in support of this measure today. I think that that the physician assistants, and I applaud the gentleman for his work, on this bill. They've really come to some positive resolutions, and I think that this is a good bill. Thank you, Mr. Speaker.
Chair recognizes the gentleman from Hardin 25 for discussion of the matter.
Thank you, Mr. Speaker. And just real quickly, we're the only state that doesn't do this. We're losing our youth to this issue. They're going to other states. But I just wanted to real quickly address the question from the lady from Fayette who asked about the KMA. I spoke with the KMA lobbyists this morning, and they did have a policy discussion this last summer, so they can't officially make a change because they're not going back for a vote. But his words to my ears were that the bill drafter and the Physicians Assistants Association addressed every concern that they had, and that they are not going to speak out against this bill, and they have every issue was concerned was fulfilled. So I just want to let you know that the KMA is good.
Chair recognizes the gentleman from Jefferson 30 for discussion of the matter.
Thank you, Mr. Speaker. I just wanted to speak briefly in favor of this legislation. I believe it was back in 1986 or around that time, Senator Jack Trivey, who was a physician and a Republican senator from Lexington, and I collaborated on the first physician assistant legislation. And quite frankly, the KMA was not for it then. But I know several doctors now who said they cannot actually do their practice full without a physician assistant. And the fact that their training has gone up to the master's degree and they've even gone to a doctor's degree now, they possess all the equipment and tools that they need in order to be a very effective physician assistant. KMA took the same position on nurse practitioners years ago. The doctors I go to, every one of them have physicians, have nurse practitioners who actually do the workup on the patients before they ever see a doctor. And with the shortage of doctors that we have in this state today, and probably will continue for a long time, particularly in rural areas, this is one of the best pieces of legislation I think we're going to offer through this General Assembly, and I urge the members to support it.
Question before the body is passage of House Bill 135 as amended by House Committee Substitute 1. Is there any further discussion? Seeing none, clerk will sound the chimes. Those in favor vote aye. Those opposed, nay. And the roll call machine is open for your vote. While members voted, does any member wish to change or explain their vote? Chair recognizes the lady from Davis 7 for explanation of vote not to exceed 2 minutes.
Thank you, Mr. Speaker. It's my honor to vote yes in honor. I've got Sarah Bickett in the gallery today, and she's studying, and we look forward to her coming home and serving our area. Thank you.
Chair recognizes the gentleman from Fayette 45 for explanation of vote not to exceed 2 minutes.
Thank you, Mr. Speaker. I would like to explain my vote. I've heard all the arguments for this, some that have expressed some concern, some members that expressed some concern to me, and I've been here a while, and we have moved to expand the authority of nurses, nurse practitioners, RNs, all of them, with various levels of resistance from the medical community. And the overriding concern is always that we need to be able to provide medical care for our people. And I think we all would agree that's a good thing, but and I think this probably is a good step given everything that's put into this piece of legislation, but I would caution this body because years ago we would have different professionals come before us and ask for just a little bit, just give me a little bit more authority, and this is all I'm ever going to ask for. And 2 years, Representative, gentleman from Jefferson, 2 years later, 4 years later, they come back and they want a little bit more. And the collaborative agreement that's in this piece of legislation, Mr. Speaker, is strong. But other collaborative agreements with other professionals have been under assault, as we should say, may say, and I would just caution because we're getting to the point, I fear, that we're sort of making it meaningless to go get a medical degree and be a doctor. So I voted yes because so many people are for this and believe it's a good thing. There are a lot of good reasons, but I would caution the body that there may come a time when they're coming back and they're going to want you to revisit this collaborative agreement, and since you're prescribing these kind of medicines, it's very serious. Thank you, Mr. Speaker.
Chair recognizes the lady from Fayette, 79, for explanation of the vote not to exceed 2 minutes.
Mr. Speaker, I voted yes for this because with the history that I have here, I have watched both of our professionals, our ARNPs and our PAs, do an astounding job across this state and develop a great level of respect that has been received from all branches of government, all citizens across this state. They really have paid their dues. They've contributed more than any of us in this room can really understand because they've met a need that was virtually impossible to meet when there were not enough physicians to reach across this state. I applaud them for their tenacity. I respect that the KMA knows exactly what they're doing. I have no problem with that. I congratulate you for this legislation. Thank you.
All members voted. Clerk will take the roll. There being 91 members voting aye, 1 member voting nay, House Bill 135 is passed. Gentleman from Warren.
Mr. Speaker, could I have the clerk report House Committee Amendment 1, the title amendment?
Mr. Clerk, please report.
House Committee Amendment 1, the title amendment to House Bill 135.
Gentleman from Warren.
I move adoption, please.
Without objection, so ordered. Gentleman from Warren.
Move the clencher.
Without objection, clencher is applied.